thanks to everyone for attending this open forum. We're really excited. I can see that people are coming in from various parts of the world. I can see from the messages. This is really good. We have a very qualified line of speakers today, and we're grateful to them for making the time to share their reflections with us. This webinar is titled A Solidarity of the Shaken, and from despair to collective action. We're going through difficult times in the global health space. Contours are being redefined, and what we had taken for granted for a long period of time, whether rightly or wrongly, is being deeply challenged. And amidst all this, we often hear calls to solidarity, especially when there are difficult moments, moments of conflict, moments of disease outbreaks. But what does solidarity really mean, and what can it do in this context? This is what we're going to try to explore today with the help of our panelists and also with the help of everybody participating in this open forum. What can we really do coming together in solidarity beyond the rhetoric to make a difference? Or is it impossible? These are some of the questions that we'll be asking. This project is part of a Wellcome Trust funded Discovery Award. And as Julian mentioned, led by the University of Ghana. I'm the PI of this project. But we also have with us some of our co-PIs who are also on this call from the University of Cape Town, Jantina de Vries, from the University of Vienna, Barbara Preinsack, from the Catholic University of Australia, we have Bridget Pratt, and from Western University, Canada, and from the University of Costa Rica in San Jose, and also other collaborators like Uni Karunakara. And what we're trying to do in this project is to understand how solidarity is lived and practiced in different parts of the world, and what we can learn, especially from, let's say, indigenous communities. What can we learn from them and bring this to help us in our efforts in the global health space? But I'm not going to go on for too long because I think the best thing to do is to listen to our speakers. So the session is going to be divided into 3 sections. The first section will listen to people who are working above all in research. The second section will listen to 2 speakers who are speaking from the CSO and community and the communities. And then the third section will be our funders in the global health space. And between each section, there will be time for questions and answers. So I'll start off with the first section. We have 2 speakers. We're particularly grateful to Professor Seye Abimbola. You won't believe me, it is very late where he is in the other part of the world in Australia, but he has decided to stay up, up to this time, almost 11 p.m. just to be able to speak to us. And Seye, after you speak, we will allow you to take your deserved rest. So just to introduce, Seye is a Nigerian health systems researcher based at the University of Sydney in Australia. For many of you, Seye does not need an introduction. He has held several distinguished appointments, thinker in residence at the Alliance for Health and Policy Systems at the World Health Organization, listed as Vox's Future Perfect 50 Thinkers. He was editor for the BMJ Global Health for 9 years and really took that journal from zero to become a leading journal in the global health space. His publications, The Foreign Gaze, many other papers, we've read them and we've all made use of them. And I think we will have a lot to learn from Seye this afternoon. And together with Seye, we have Professor Judd Walson, whom I had the pleasure to meet a couple of months ago at Johns Hopkins University. Judd is the Robert Black Chair of the Department of International Health and serves as Professor of International Health Medicine and Pediatrics at Johns Hopkins University. His work is extensive. His focus is primarily in ways of identifying how to reduce mortality among acutely ill children in low and middle income countries. He has worked in various African countries. If you want to list I mean, you can go up to, more than 20% or 15% of the African countries. And he's also involved in many large, multi-country research projects. And these are the projects that today, with the funding cuts, are also facing so many difficulties in keeping up these collaborations and developing capacities. So I'll start the webinar or open forum by throwing a question at Seye and Judd so that you can get us going. No. So the question is this: how do you see solidarity playing out in the current context of reductions in funding, or does solidarity have a role to play at all? So, who wants to start?
I'll start because I want to make the most of my attentiveness. There's a line. The simple answer is yes. I think it does have a huge role to play, but I'll make my case for that answer. There's a line. I grew up in the church, so I always think with the Bible. There's a line in the Bible that goes like this: can two work together except they be agreed? That's the old King James Version, except they be agreed, but essentially it means except they agree. And that's such an important line, I think, in how we think about solidarity, because for me, solidarity means having shared interests, shared objectives, shared standards, and shared sympathies. In other words, that we agree on these things. And they're all, for me, very important things when we think about how research works or research should be done in the field in which we work. And the way that I tend to think about the field is that we are working on inequities and injustices. And one of the things that requires of us is to work with people who have less power than us. Now, it is not easy to have shared interests, shared objectives, shared standards, and shared sympathies with people who are of significantly less power. No matter how much we want to believe that we do, it's not an easy thing to do. And to my mind, a moment like this, a moment of stress, I think, of tension, of difficulty, as the field is going through, can either put a strain on those relationships and make them even more difficult, or can release those relationships and actually allow them to work even better. And I feel as though the decision is in our hands, how we want to go. But ultimately, to my mind, solidarity and finding ways to ensure that our interests are shared is at the heart of it. And I'll quickly talk about two sets of relationships there. There's a set of relationships that's between researchers who are privileged and those who are less so. And often in our field, that will be researchers in the global north relative to researchers in the global south. Not always, but often that will be how that power relationship works. Now, a period like this may put a lot of strain on that relationship because as it is, a lot of researchers in the global north work on soft money, soft funding. And when that funding dries up or reduces significantly, a lot of the efforts and success that I think we've made in the field for moving more towards equity and towards more just ways of relating becomes put in danger. They're having lots of discussion about authorship, imbalance and fairness. There've been lots of discussion about sharing or redistributing resources and being inclusive. Those discussions are often easier to have when there is some kind of abundance. When resources strain or are pulled up, it's more difficult to be able to function in that mode. And that for me is one of the ways in which this current moment can really strain those relationships, because my sense at least was that we were inching towards a place where we could be more equal in those relationships. So that's, for me, something we have to think about carefully, because I think that will be essential to how we move forward. And then there's another relationship, which is the relationship between those who do research, wherever they are, and the communities that are researched or on whose behalf research is done. My sense is that, and this has often bothered me, is that in a lot of our discussions about solidarity and greater equity and fairness in relationships, we focus a lot on the relationship between researchers, not so much on the relationship between researchers and those who are researched. Because again, what does shared interest, shared objectives, shared standards, shared sympathies look like in the relationship? And my sense, again, in my optimistic mode, is to think in terms of how often attention and accountability can be zero-sum. In other words, if I'm paying attention to person A, there's a tendency to pay less attention to person B. And my suspicion or my hope is that perhaps one of the ways to think about how we move forward is to say there have been a lot of accountability directed towards big funding agencies, big research agencies, big institutions, and what they want and what they prefer, which are often not necessarily aligned with what communities want and prefer and desire, etc. Perhaps this period in which things are being shaken up can allow us to reimagine what the relationship and what the solidarity might look like between researchers and those who are researched. And again, that my optimistic mode, which I am tonight, can actually move us closer to a place where we begin to have those shared interests and standards, and we actually have these discussions. And I believe very strongly that how we operationalize solidarity in this moment will depend very much on how clear we can be about the interests we want to share and the objectives and the standards and sympathies that we want to be collective around and about. Because without that, really there isn't solidarity. So that's how I answer the question.
Excellent. Thanks very much. We'll come back to that, but these are really important points. Judd, what's your take?
Yeah, no, I would first of all just appreciate those first comments from Seye, and I think a lot of what I will say maybe builds on or resonates with that. First, to just say that, solidarity, I think of in this moment as being not just a simple definition of, unity or an agreement around where we need to go, but really solidarity is about collective action. It's a movement, not a theory. And so if we think about examples of where solidarity has had movement, thinking about, for example, the trade labor movement in Poland, which resulted in sort of mass campaigns that overturned political realities. That's, to me, what solidarity means. And as such, solidarity, I think, has to start not with a discussion of the funding per se, but a recognition that the funding is a tool in our box, but the funding will come as a result of the solidarity movement that we seek to build. And we have to say that right now, in the face of all of the reductions in funding, that the threats that we're facing, as you alluded to, Cesar, earlier, it's more than the funding. It's a philosophical attack on many of our values. The idea of an equivalence in the value of lives around the world, the moral imperative towards addressing inequities around the world, the criticality of recognizing and addressing and reconciling with colonial history that has led to imbalances. That's what's under attack, and that's where I think we need to develop this movement of solidarity. And then, whether or not the funding comes along, we will be able to respond in this moment with a collective voice and a collective movement, as I said. But I think there are real barriers. And as you just heard, I think the moment is going to strain some of the required relationships to build that towards that. I've said in the past that, as a member of a high income country academic institution, I have often entered into relationships in this space from a position of privilege and power. And I think, first of all, it's important to recognize that all relationships, all human relationships, do have power differentials, all of them, whether it's spousal relationships, friendships. And I think we have to get to a point where we acknowledge that the goal needs to be able to manage those power imbalances in a more constructive and equitable way. But we're not going, I don't believe, we're going to be able to completely dissolve those power relationships. So we need to manage the power, but also to recognize that the decision to share one's power is itself an exertion of power. So when I decide that I want to engage in more equitable relationships and share authorship or whatever that is, if I'm doing that from a position of power, then my decision of what to share, how to share it, who to share it with, those are all exertions of power. And so now in this moment where things are really disrupted, I think we're seeing, as we heard earlier, a tension here that's being exposed maybe in more detail than has been in the past, because it's not so clear where that power lies. And we have a concept in the US, that was brought up by a sociologist, D'Angelo, back in 2011. It's a concept called white fragility. And it's really when individuals, particularly white individuals, are exposed to stresses around racism, that often leads to a defensiveness that manifests as anger or fear or silence, or trying to exit the situation. And I think in some ways, we're facing a similar sort of fragility. Maybe I don't know what the right term would be, but a sort of a partnership fragility, where we're seeing a response from those in power of defensiveness and of fear and of silence in the face of a common threat. And I think part of this solidarity movement needs to be recognizing and addressing that very real fear on both sides, on the side of those who traditionally have held more power and those who haven't, and coming together in this collective moment to agree on our common vision and mission, but to do it in a way that recognizes how those power relationships can be managed more effectively to move us forward. So lastly, I'll just say, I really do very much believe that the goals that we all share and the philosophical values that I stated earlier are what bring us together. And in so much as we can remain focused on the necessity of working together towards those goals and the necessity of improving lives and livelihoods around the world for everyone, then I believe that the solidarity we can manifest will be coming from a place of common movement. And that's where I think we'll have the opportunity to have impact. And I truly believe that eventually, because I know that the problems we face are not going away, and in many cases will be exacerbated over the next few years or decade, that the funding will manifest itself as a necessity to respond to the realities of the world. And so again, just in closing, I would just say, let's start the discussion of solidarity as an important and necessary vision for how we move forward the agenda. And I really do believe that the funding will follow. Thank you.
Excellent. Two very powerful interventions here. I'd like to just invite our attendees. If you have questions, you can always put them in the question and answer section, or if you raise your hand and I see you, I'll be able to call on you to speak. But as you can see, we've had two important presentations. Seye speaking about, the shared interests, shared goals, objectives. And I quite like that point of also talking about accountability to communities. I think that is very important because sometimes it can become a self-centered interest discourse of us academics just talking among ourselves and not looking in the right place. And then the idea that Judd underlined that, look, these are about relationships, and in all relationships, there is power. And managing that power equitably is important. And then the idea, I think this is very important, solidarity is an action word, that this is a movement. It's not just a discussion. We need to get doing something. So I'll open the Q&A and also the hands up. I can see some hands up. I'm not a very technical person, so bear with me if I'm a bit slow. I see Allah, if you can ask your question, and also if you would like to turn on your camera too, that's fine, so that we can see you, and just tell us who you are and where you're from. That would help.
Fantastic. I hope you can hear me well.
Yes, we can hear you.
Fantastic. Yeah, I don't have the option to turn on my camera, but I'm very delighted to see you and the panelists. My name is Ella. I'm a doctoral researcher based at Center for Global Health Research here at Oxford. And I think I just wanted to thank both panelists for the really insightful comments. Perhaps my question would be to share on shared visions and shared objectives, shared sympathies. And listening to that, it does sound aspirational in a little bit, because conflict is inevitable, and I've seen it. I come from Sudan. There's a humanitarian crisis going on. There's so much solidarity and collective action on a local level, but there's also a lot of conflicting interests that manifest. So my question becomes, how can people from different ideologies, races in some instances, or even just different social class, bring themselves to solidarity and work together for collective action?
It's a really, really good question. And I will be brief. And I too have been in situations where interests are not fully aligned, and in which objectives do not fully align, in which our standards, in other words, the things that one might say constitute a basis for the kind of collective action that solidarity ought to inspire, it's not fully shared. But the way that I think about this is to begin first with just the simple fact that we are all human beings, and there's something basic in that. In other words, we share at least the interest of the value one might expect, at least for most of us, that human beings deserve dignity, that freedom is essential and important. Again, we can differ on the edges of what those things mean and what they require, but there are basic things that most of us will agree on. Now, and that there are ways to be in solidarity with people with whom one does not fully agree, or with whom one does not fully agree today, right? Because there's also that possibility, which I'm always very open to, that people change, people learn, people think, that people are not static. That I can empathize with people who want to kill me, while at the same time, of course, trying to kill them back, if I have to. But in other words, that we don't have to agree on everything, but we can agree on the basics, and there's a lot of basics on which we can be connected. And certainly the dignity of every human life, and every human's desire and quest and yearning for freedom is where I anchor what those basics look like.
Excellent. Thanks, Seye. Judd, do you want to add to that? Oh.
No, I mean, I would just, maybe one thing I would say is, I think in our world of health, many of us are trained in a scientific tradition. And we're trained to evaluate options based on sort of how we interpret evidence as what the best thing to do is, which leads us to a very binary way of thinking about choices. That the choice is to do A or B, and in my mind, the evidence says A, whether it's moral evidence or scientific evidence, whatever it is, we should do A. And that leads, when somebody thinks we should do B, to a fundamental disagreement that we have trouble resolving. But there's another way to approach the world, and that's the way sort of diplomats approach the world, which is that the goal isn't really to get to A or B. It's to try to get as far as I can get you to A as I can, recognizing that you're going to get some of your B decisions too in our negotiation. And that a success in that discussion leads to a mixed result for everyone. But as Seye said, that doesn't end the discussion. It may be that we're moving over time towards something we want. And I think in our community, we have a tendency to be closed off to that sort of diplomacy in moving towards resolutions. We tend to be very sort of set in what we think the end result must be. And so as we think about engaging, whether it's with communities who may have different viewpoints or with politicians who may have different viewpoints or other scientists, I think being open to the idea of flexibility in our endpoints and understanding that the world needs more diplomatic approaches, I think that that's where solidarity as a movement will take us further when we can approach things in that way.
Great, thank you very much. That's good. We have a question from Doji Kokuhato. Could you?
Yeah.
Yes.
Yeah. So I'm Doji Kokuhato from the University of Ghana and also consultant specialist for Kimati and Partners, a law firm in Ghana. Yeah, and I like the presentation on the dynamics in funding and also the idea of movement when it comes to solidarity, movement towards maybe a common idea of humanity. But my concern is about funding. And from the global south, you know that we have been depending on funding for a long time. I just heard yesterday that they announced that in my university, there's resurgence of COVID-19 again. And the society, everybody is shaking in my office now. And I keep imagining, okay, they have cut funding, vaccines, and all these things. So my question from the philosophical perspective first, as funding for global health research declines across various regions, where does solidarity find its place in the evolving landscape now, this geopolitics? Perhaps in a different way, our support for global health research wanes. Can solidarity still serve as a driving force for meaningful progress of humanity?
Okay, that's a difficult one. Anyway, if you'd like to answer briefly, Seye and Judd, and keep in mind that, we have funders who will come in the third section, so we can resurface that question to them as well. Yeah.
Well, maybe I'll start and then I'll pass it on to Seye. So I was in Bangladesh a month ago, or maybe 6 weeks ago, and we were at ICDDRB, the International Center for Diarrheal Disease Research, Bangladesh. And Tamid Ahmed, who's the executive director, and I were talking. We were talking about this current crisis. And we reflected that 65 years ago, in 1960, if you were standing on the edge of the world looking out, at that time, remember, less than half of all girls around the world were receiving even primary education. At that time, child mortality, maternal mortality was 3 to 5 times higher than it is now, 1960. At that time, there was no USAID. There really was no global financing architecture for health. There was no ICDDRB. There was no Johns Hopkins Department of International Health. There was not, think of all the institutions that were affiliated. How many of them existed in 1960? And yet, there were visionary leaders across Africa, across Asia, across the world, who looked out at that landscape and said, this is unacceptable. We will make a difference. And what emerged from that was I think, the most incredible success of humanity in our history as humankind. The unbelievable improvements in livelihoods and lives around the world that have resulted. So I agree with you. I'm not trying to be evasive about your question about funding. Funding is critical, funding is important, and funding must follow. But I also think we can't let funding and the lack or the availability of funding dictate what is important. What is important remains important regardless of whether the US administration wants to fund it or not. It's still important. It's a fundamental reality. And therefore, it is imperative that all of us look forward. And that's what solidarity is about, is saying this is so important that we will make this happen with whatever tools are available, be it great amounts of funding or less funding, we will make this happen. Seye?
Another big question. I will answer in two ways. The first way is not a very good answer. I don't think the person who asked the question will like this answer, which is that a lot more can be achieved with less funding than we allow ourselves to imagine. When you look at the current landscape, or the one that is just recently gone, there was a lot of ways in which efficiencies could be achieved. And that's another way of saying there was a lot of waste or a lot of pointless spending. So on the one hand, we could do a lot more with less, but then that would require of us that solidarity and that shared purpose and interest and ways of imagining how things can be different. And the second way to answer that question is to go back to the reason why countries in the global south need transfer of money in the first place, and just how little that transfer has been historically. It's not, there's a tendency for us to think that the money that comes to Nigeria, Ghana, Zambia, Malawi, etc. is big. It's not big, right? And again, I will point your attention to there's a nice analysis by IHME. I don't like IHME, but I like this analysis. So this analysis sort of shows that in low-income countries, right, about $11 per capita is spent on health in a year, right, from foreign aid, and 10 comes from within the country. It's about $21 per capita. Compared to high-income countries where the number is about $5,000 per capita. Yeah, 5,000 to 21. Just gives you a sense of scale that in low-income countries, 11 per capita. In lower middle-income countries, it's like I think 47 to 400 and something. So again, these are small numbers relative to what people in a country really need to live healthy lives. And ultimately, the biggest determinant of how much money is spent on health in a country is how much money the country makes. It's not how much money comes from outside, it's how much money the country makes. So again, for me, thinking about solidarity in ways that is not just global north pointing, but also global south pointing and saying, how can we in country X achieve the higher revenue that allows us to spend money on health? Because frankly, many low and lower middle income countries have very little money, even if the governments are being responsible. And I know many of us, I'm a Nigerian, I can't complain about my government forever. Even if the governments are being responsible, it is still little money. Not Nigeria, you get leave Nigeria aside because I can't afford excuses for Nigeria. But the problem is the little money. It's the little money in the country. And that really is one of the places where we should direct our attention in this moment.
Great. This has been very interesting. I see Alberto Jubilina, Dr. Alberto Jubilina has been waiting with a question for some time. So we'll take Alberto's question as the last question for this session before we move on to the next section then. Alberto, are you still online?
Hi, can you hear me?
Yes, yeah.
Okay,
Yeah.
so I have to switch. Yeah, so I had a question that actually the first question I got asked was a version of the question I wanted to ask, but I would like to push you a bit on the answer you gave, because so there is this problem about having shared interests and shared standards as, say, the distinguishing feature of solidarity, which I find a bit difficult to conceptualize. And the first question problematized this aspect, but your answer, it seems to me, were very much at the intellectual level. So we were talking about disagreements and therefore finding compromises through diplomacy, for example, which is great. But there is another sense in which these shared interests are problematic. So that is the conflict of interest between the interest, for example, of wealthy nations and the collective global interest. So it's not so much about disagreement on ideas, concepts, it's about interests that pull in different directions. And that's true not just for global health, it's true for many other collective action problems that we have, like climate change, for example. It's almost never the case that wealthy individual, wealthy country sacrifice something for the sake of the collective, or if they do it to a very, very limited extent. Same with foreign aid, for example. So I wonder if solidarity is, after all, a useful concept if it needs to be something about shared interest, because it seems that these shared interests simply don't exist. Now, we can agree in principle on what should be done, but because interests pull in different directions, for example, about allocation of resources globally, it's always the case a wealthy country wants to keep more resources for themselves. We saw it in the case of distribution of COVID vaccines, for example. So I wonder if you can say something more about to address the challenge, not so much at an intellectual level, but at the level of conflict of interest, individual versus collective interest. Thank you.
Great. Thanks. I mean, if you could just be brief with your answers so that we'll move on, if you don't mind. This is really interesting. Alberto, that's a difficult one you asked. Yeah.
Well, quickly, I can just say, I mean, Alberto, I agree with you. I think there is often misalignment of interests, but I would disentangle the difference between having a shared set of values and a shared set of interests. I think those are different. I think we can agree on a shared set of values. For example, I think most people, not all, but most people would agree that we don't want infectious disease threats spreading around the world and threatening populations everywhere. Now, the interests and sort of how we apply that may differ. For example, in the US, there's a big debate about, vaccine mandates. But when you get down to it, on both sides of the political divide, there are many interests. And people disagree about whether we should mandate vaccines. But there's actually not a lot of disagreement on the idea that we need everyone to be vaccinated to protect the population. People on both sides of the political spectrum agree that that has to happen. The disagreement is around the interests about whether everyone should be mandated by the government to get vaccinated. So I think by breaking this down, if we have a shared set of values, then we can negotiate the interests. And that's to what my point was earlier, that we have to be willing to approach those interests in a diplomatic way. Seye?
I don't think that I'm necessarily in solidarity with the government of the United States, whether today or 10 years ago. In other words, I don't think that the people who run the US care very much about Africans. I know that many Americans care very much about Africans. That's a different thing. But I don't think the government necessarily care. And those who vote for them in certain ways, I don't think they care very much. So there's also something to be said for the we in solidarity. I think as human beings across the world, there's a lot of shared interest and there's a lot of solidarity. Now, among specific power holders and power centers, there often isn't that. And again, how one plays the game between people's solidarity that can shift the political landscape in different parts of the world is how I would approach your question. That there's always, people who have power always want more, and governments tend to want more. People within countries, within groups, can have cross-group solidarity that can then change the political landscape that govern people in the spaces where they operate.
Great, thanks. Thanks so much to both of you. I see Barbara Prainsa, who is a co-PI on this project and has written quite a fair bit about, quite a number of books about solidarity, wants to weigh in on the conversation. Barbara, would you want to weigh in on this question?
Thank you very much, Cesar, and thank you, panelists. And yeah, my new book, which will be out next year, with Oxford University Press, will actually talk about this question about difference and interests. I think there's a frequent misunderstanding around the emphasis of similarities as a characteristic of solidarity, meaning that it denies difference. So it does not. Many of those of us who emphasize that the recognition of others similar to ourselves, this takes place amidst and despite differences that obviously exist between people. So to use Ala's example, one doesn't need to have a personal connection to the region to be in solidarity with people suffering in Palestine. You don't need to be a woman to be in solidarity with a woman who's the target of sexualized discrimination. So solidarity takes place when there's this kind of recognition of similarity despite differences. It's not a denial of difference. And I think it's probably time for a woman to speak about the dominant notion of interest here in this panel, which is very masculinist, I'm sorry to say, understanding of interest as something that is stable and comes from, I don't know, comes from seemingly nowhere. Interests are shaped by our relationships to other humans and non-humans, even to our artifactual environments. So interests can also be shaped, and they come out of, very often also, partly out of sort of political rhetorics. If you live in a country, or if you grow up being told all the time that certain people are different from you, it will be more difficult to see similarities, and your interests will be correspondingly that you may see yourself in contrast to others. So I'm not saying everyone is equal. I'm not saying we're all the same in every respect. I'm saying that solidarity takes place despite and against the backdrop of difference, but saying that solidarity revolves around people recognizing others as similar to themselves is quite important, because otherwise we lose the analytic value of solidarity. Otherwise, solidarity is everything that's kind of good and nice, right? So that's why I think it's important to maintain that this kind of connection and similarity is quite important to solidarity amidst difference and struggle and inequality, which we must not be blind to. I fully agree.
Excellent. This has been very, very, very rich. Thank you very much, Seye and Judd. Seye, thanks again for staying up so late for us in Australia. And with this, I think we'll move on to the next section. Time is moving very fast. So we'll have with us Georgia Nicolau. She's the co-founder and executive director of the Instituto Procomum. And as a co-founder, she draws on more than 20 years of experience in community innovation and cultural policy to advance a more just and cooperative world. Her work spans different areas: climate justice, feminist economies, civic engagement, and includes various leadership roles at Brazil's Ministry of Culture, as well as collaborating with global partners. We're to have with us, Mercy Mwangangi in this section, but unfortunately, Mercy couldn't make it today. So I'm sure Georgia can guide us in our reflection on this second question that we have for us for this part of the forum. And the question is, Georgia, if you would like to talk to us around this topic. Civil society movements or organizations have a history of enacting solidarity to establish change and achieve transformations. What lessons can we learn from the bottom-up approaches to promote greater equity in global health? I know it's a broad question, but yeah, you take it the way you want to take it.
Thank you. Do you hear me well?
Yes, we can hear you.
Okay. So first of all, thank you for the invitation. I had the pleasure to meet the research that you're doing during an Atlantic Fellows convening last year in Colombia with Julian. And I feel very grateful also for being in this space, because I'm usually not in the global health space, let's say. But it's been really interesting to hear my colleagues and to find our shared questioning around the world, and also reflections, critical reflections, and the nice and healthy disagreements that we've seen, which I think are very, very welcome. So my name is Georgia. I'm speaking from Brazil. I'm from São Paulo. I lead an organization called Instituto Procomum. Procomum comes from the word commons. So we, since the beginning of the organization, we have been putting commons at the center of our practice, of our values, and of our investigation as well. And what we understand as commons is a quite, let's say, similar in some ways of how you understand solidarity, I think, right? I think, first of all, I think why we chose to do this work, I'm just telling that because I think it makes sense to the bigger conversation we are having. I think there's a crisis of decollectivizations of the action, right? We have been captured. And we can even think of possibilities and solutions that are out of an individual trajectory of either consumption or the bureaucratic relation of the state or multilateral agencies, etc. Right? So I think reclaiming the commons as a political practice is also remembering that, we are capable of living in collective, and that can also be practiced, that can be learned. But also, believing and choosing collective action does not make it less complex, full of contradictions, right? So it's not an idyllic solution. And that's something sometimes it bothers me when we're speaking about solidarity or commoning or etc., such as like a idyllic solution where ideally everybody is just going to be friends and make peace. And that's not going to happen, never, right? So we are all different from each other, and that shouldn't be a problem that we have to move on, but we have to work within our differences, and that's our value, right? And what we do with that. So what other technologies, social technologies we can develop to work within our differences for collective solutions. And commons for us also weakens the totalizing beliefs and hopes placed on the state and the market, because it shifts the center of the discussion to the relations we establish in every day, and that most of the time in an invisible way sustain our life, right? And I think feminists and indigenous and Black feminists, they have been teaching us that from a long, long time. What is sustaining our life is our relations. This is what sustains life. And from relations grows United Nations, Oxford University, and everything else, right? So the driving force is a necessity of relationships, but it's also a system of beliefs that go beyond materiality, right? So the point of arrival is not a given, because it's being made as we relate to each other and in this world, And I think that the way Procomum also sees commons is the commons itself, right? Like as the natural resources and as the world and the air and our languages, etc. But it's also a governance system operated by a network that connects users to their communities and to the planet, right? But it's also a political process that calls for action, but can also be an economic alternative that generates relations of reciprocity within the communities, being that local or global. Also generates generosity and solidarity, favoring the value of use as opposed to the value of exchange. Right. And I think that's also important to say that when we're speaking about global health and financing, I think we have to be speaking about economy and politics, right? So what's the role of politics and economics and the choices we've been making as a society have led us to that. And I don't mean by voting. I mean from the root causes of that, right? But commons is also about a collective effort consisting of humans, non-humans, and other living beings that co-inhabit the earth, which itself is a living organism. And therefore, it consists of a socio-ecological system. And lastly, it's also a cultural transformation of that can be great proportion, because it's a result of a process based on fraternity, meaning, and why not spirituality? And I don't mean religiosity here, right? So we consider that a great tutorial for life of joy and imagination, and that not means free of conflicts at all. Doesn't mean free of suffering or free of pain. Okay, and I like to say that all the time, because I think sometimes we idealize these processes, right? So for us, commons is an alternative for the reorganization of the production system around care and solidarity. And I'm going to say a bit more about on the care part of it, because Procomum in the last years have developed a lot of methodologies of citizen innovation that have care in the center of it. And there are many reasons for that, but one of them that I would like to highlight is that if you want to sustain political transformation, we have to sustain our relations. So we have to invest in care and politics of care and technologies of care and caring for each other and caring for the spaces we are creating. So there are ways that you can create an infrastructure that can be facilitating collaboration, or you can create infrastructures that are mining collaboration and that are fueling more competition, right? And these are choices, and the choices are also on the small parts of it. So and another thing that I think we've been also working a lot is like
Georgia,
sorry, yeah.
Sorry, we have just 1 minute so that we'll leave time for the questions. If you can wrap up so that we'll have time for the questions.
Yeah.
Yeah, thanks.
Yeah, okay, sure. So lastly, I think it's one thing that I would like to leave here as well is about new institutionalities, right? So we have to think about, if you can think about commons as shared resources within a community with protocols that can be fast changing. What are the agreements we're making for our institutionalities and collective organizations? So I think to think about how our organizations work, being that our universities, our departments, our research groups. So are the agreements clear? Can we talk about them? You know, when people are entering this institutionality, is it easy to understand, you know, the rules? So I think that that's something that I think it opened up a lot to us as well. And yeah, so we've been doing that in scale of globally and locally by creating spaces of collaboration to develop solutions, being that for climate adaptation on a given territoriality, but also during pandemic, digitally. So how do you create infrastructures where people that were strangers with different expertises, academia and popular, can collaborate, and a hands-on approach where you can deliver solutions for the commons, because a lot of the problems are commons, right? So the solutions can also be. Thank you.
Excellent. Thank you so much. Sorry, I had to tell you to wrap up. And I see there are some questions in the chat. And this has been very interesting. You're talking about the fact that, I mean, we need to protect the commons more on relationality, and the fact that solidarity and, I mean, working for the commons is not just a kind of happy place, but it's a place too that we have to deal with our differences. So we have a question from Mercury Shitindo. Mercury, do you want to ask your question to Georgia, please?
Mute.
Yes, we can hear you now, Mercury.
Sorry, I don't know what happened there.
Yes, we can hear you. You go ahead.
Thank you. Thank you. I'm Mercury Shitindo from Africa Bioethics Network. I guess my question is that sitting from where I am, and I don't know if other people are feeling the same way I'm feeling, is that sometimes when we are discussing solidarity, like when you're also talking about commons, sometimes it tends to start becoming very technical from how we understand it. Is there a way we can be able to change this? Or I don't know if it is the description, to know exactly what do we mean when we say we are standing in solidarity. You're talking about commons, but what does that mean? You know, identifying with, you know, the commons. Does it mean coming up with does it mean that we are going to come up with one way of doing things? And how does that identify or recognize the specific nuances that come from a different context, from the different places? So I feel like sometimes when we are speaking about this solidarity, sometimes it stops being the understanding that we know and becomes technical. So how do we interpret this, as a community? So thank you.
Okay, thank you very much, Mercury. I think, Georgia has some examples to illustrate what she's saying. And yeah, Judd and Barbara, if you also want to come in briefly, and then we'll wrap up this section then. Georgia.
Hi, yeah. Thank you for your question. I think it's a really important one. And first of all, I think commons for us, and also I think solidarity for the research, as I read, is a situated concept. That means that it's not totalizing and cannot be homogeneous. So it depends on the territory, on the culture and the communities and how you relate to each other, right? So it's more like a force of an idea that we can, that we have been for years reproducing life, and governments have come and go. We had feudalism, we had all kinds of economic systems, but our relationships is what brought us here. So one example I'm going to give you from the history of Brazil, okay? Brazil has been colonized and is the country that has had most of Africans kidnapped to come enslaved, right? That means we have a big Afro-Brazilian population in Brazil. That when the abolition came and we were the last country to abolish slavery, there was no practical, economical policies to include this population, right? So that means that still nowadays we are a really racist country and Black people are still at the basis of the pyramid. But so the question is, how come there are still 54% of the population? So the Black movement will answer that really clearly with examples. It's because they shared what they had. They had their resources, they had their spirituality, they had their creativity, they had, they have the entrepreneurial, they had their visions, their culture. And because they shared this, they were able to thrive, not because of the state, not because of the market. So and I think this is really practical, that the way that happened in Brazil, and it's true everywhere you go, especially when you have absence of policies, when you have inequalities or you have racism and colonialism. They left nothing, right? They extracted everything, but they didn't extract ourselves from ourselves. So what can we do with what we have? And I think it's shifting the conversation. And that doesn't mean saying that we don't need reparation, that we don't need politics of reparation, but it's looking at what do we have, what do we share, and what can we do with our shared resources.
I think that's a very powerful answer. Thank you very much, Georgia. Yeah, and that's the idea of, solidarity being what can we do with what we have. I see there is another question, but let's move on to the next section, and then we'll take the questions at the end of the presentation of the next section. So we're now moving on to the area of people involved in funding. And we have with us two very qualified speakers, and I'm really happy that they've made the time to be able to speak to us this afternoon or this evening, depending on where you are, or morning. So we have Professor Ntobeko Ntusi, who is the President and CEO, South African Medical Research Council. Professor Ntusi is really a global opinion leader in medical health, in the medical health spaces. Previously he served as chair and head of Department of Medicine at the University of Cape Town. He's a distinguished global opinion leader. His lifelong dedication to evidence-based health systems research, and above all, universal health coverage have made him a trailblazer in the field. And together with Ntobeko, we have a colleague and friend, Professor Alice Norton, who is the head of Policy and Practice Research Group at the Pandemic Sciences Institute of the University of Oxford. With over 20 years of experience in global health, Alice leads cutting-edge research on pandemic preparedness and response, advising both academic and funding institutions. She's also the scientific director for Global Research Collaboration for Infectious Diseases Preparedness, GLOPIDAR, supporting global health funders in shaping effective responses to infectious disease threats. And she serves as academic and policy lead for the Africa Pandemic Sciences Collaborative. Alice has a lot of experience in the field of policy.
Alice a beaucoup
Funding.
d'expérience.
Sorry, I can hear the French translation. and policy and funding. So I'll hand over to Professor Ntobeko and Ntusi, and then Alice, and you have about 5 to 6 minutes each, and then we'll have the Q&A. Thank you.
Thank you very much, Asiza. I'm grateful to you and your colleagues for taking the time to initiate this important discussion and for inviting me to contribute to the conversation in the company of my very esteemed colleagues. I agree that the world we live in today has changed drastically, and we are witnessing daily greater suffering, greater polarization, greater suspicion for international collaboration, and ever-receding global solidarity. And my view is that science in general and global health more specifically finds itself in a moment of great precarity and an existential crisis we've never witnessed before, at a time when the fruits of scientific advancement are ripe for all to enjoy. The receding trust in science and the decline in global solidarity means that fewer and fewer people can benefit from these advances. And sadly, the most vulnerable populations remain the most exposed, even if their locations often serve as sites of knowledge production for advancement of global health that improves health outcomes for all. So to achieve solidarity, the pursuit of equity, social justice, and health justice must be at the center of all global health efforts. And real partnership will be key to achieving these laudable goals. So what can we as funders do? And I have 5 brief points to make. Much too often, international donors and funding organizations who come as saviors prefer to fund projects that address their own interests on their own terms and with onerous reporting. This in turn leads to wasting of resources, often lack of local buy-in, and loss of local research interest. And importantly, a loss of trust between funders and those who want to make a difference. And even when the research or implementation work is focused entirely on low and middle income countries, much of donor funds are given to agencies and institutions in high income countries who hold the purse strings and by extension, the power. So this needs to change. And in building solidarity, therefore, first, high income countries must be willing to yield some power if we are to grow more equitable global health networks that can foster a more equitable world. In the pursuit of equity, social justice, and health justice are key. And if we are trying to achieve this, we need to address the intersecting systems of privilege and supremacy that continue to limit our ability to achieve such equity and justice. And it's important to keep in mind that inequities are not only about the needs and concerns of the disadvantaged, but also the systems that create and perpetuate these disadvantages. And funders need to recognize that the current structures in global health benefit high-income countries, even when that work of science is completed in the global south, a collective I prefer to refer to as the global majority as its home to 80% of the world's population, and on whose back the careers, the status, and prestige of many global health actors, scientists among them often grounds. So true, those of us who have a voice in global health should collectively affirm our ownership of the field. The global majority, I feel, need to claim the space in global health that belongs to them and is proportional to the size of their populations, the size of their knowledge, and the size of their problems. We need to convert the opportunities we receive into opportunities we can give, weaving networks of solidarity with peers and building collaborations across the global majority without necessarily dismantling North-South partnerships. In many settings in Africa, for instance, universities and research institutes are much more likely to have high-income country than in-country or in-continent collaborators, which are essential for solidarity and learning across regions and countries. And so funders can play a really key role in enabling these partnerships amongst those within the global majority. And within all communities, there's also a need to engage and foreground the voices of women, frontline workers, and people with lived experience, since they are often invisible in national consultations and committees. 3, low and middle income country governments and institutions need to invest more in their own healthcare delivery, their own health research, and their own health training to reduce their dependence on high-income country donors and philanthropies. And this will ensure that funding is better aligned with national priorities. In situations as we have witnessed recently, where countries like America can weaponize programmatic global health funding due to their substantial influence, resulting in instantaneous loss of livelihoods, care, and lives for millions world over should never exist. Therefore, building quality research and teaching institutions in the global majority is critical to reduce reliance on high-income countries to improve the overall quality, depth, and relevance of scientific training, research, and conduct. And fourth, we need to build solidarity by keeping the focus solely on pathways to impact, the reduction of inequities. As funders, we can influence how the academy incentivizes research. And much of global health is conducted through universities and similar research entities. And I witness what I see to be a major problem that academics are incentivized to focus primarily on personal development, issues of tenure, personal awards, publications, impact factors, prestige of grants, often at the expense of real impact. Universities and academic institutes involved in global health need to be held accountable by funders for creating structures and processes that incentivize academics to be better allies, giving credit to high-income countries and other privileged global majority colleagues for supporting allyship work and power sharing, and to be responsive decision makers on the ground, engaging organic local processes and indigenous knowledge. And then finally, funders need to work with local communities in the co-creation of scientific codes so that the science is responsible, and most importantly, is relevant. These relationships must be predicated on trust and mutual respect and clear communication of roles and expectations. In thinking about the loss of solidarity, funding agencies, particularly those in the global majority, need to focus on how they build their own agency rather than building new dependencies that may leave them in a similar position in the future. I'll stop there. Thank you.
Great. Thank you very much, Professor Ntusi. This was very, some very important points there, those 5 points. So, Alice, over to you, Professor Alice Norton.
Thank you, and very helpful to go after Professor Ntusi. He's covered a lot very, very well. I'll therefore take a slightly different approach. So in terms of my positionality on this, I have been a funder. I worked for the Wellcome Trust for 9 years, but now I do a lot of work with funding organisations. So I've worked with a network called the UK Collaborative on Development Research for several years, which brings together all of the UK funders to try and improve the coherence of their ODA research spending. And then also more recently, obviously, I still work with the Global group of funders, which brings together 35 of the global research funders to, again, improve the coherence and the impact of what they do for pandemic preparedness and response. So it's that lens that I bring in now. So I don't speak as a funder, but I speak of, due to the interaction support to funders and also research on funders, do a lot of work to track research funding and, particularly looking at tracking those funding cuts at the moment. So one thing I wanted to start with is how research funding is seen. The framing of the question we were giving for this is that it isn't necessarily usually seen in the context of solidarity. It's seen as aid. That term, ODA, Overseas Development Assistance, is clearly one that is used in the funding field, and it's particularly that is being cut by many countries around the world currently. What I'd like to say in respect to that is I think the framing of that and research isn't necessarily so obvious. Research is primarily about developing new concepts, finding new ideas, finding solutions. And to me, that has more of a basis to solidarity in it than the idea of aid. And I think this is useful at this time of overseas development assistance cuts, is to fall back on the framing of what is research for. And if you see research as for the generation of knowledge, and if that knowledge is of use to multiple partners, some may be high income, some may be low income, but that is to answer shared problems, then I feel that is a potential route by which we can get out of some of the current issues of research funding being seen as aid by reframing it as it being seen as providing solutions to shared problems. We're in the early days of that, and we'll see how that progresses. One other way I thought it was quite useful to think about this is from the individual funder's point of view. So I know the Wellcome Trust most well, who are, of course, in a privileged position of being a philanthropic organisation with a lot of money, with limited geographical capability, restrictions and such. Like, not all research funders are in that position. But despite that, there's been quite a lot of thinking, which I think could be seen around the idea of solidarity, around how research funders could improve their processes. So if we start with the life cycle, the first thing that research funders do is they identify priorities. And they come up, usually that goes into the call text. Where are they going to put that funding? So there's been a lot of work on how those priorities should be identified, who should be involved in the setting of the priorities, and whose priorities those should be. In particular, a lot of guidance coming out about the importance of the end users in it. And I'd also point people to some really exciting guidance that came out this week from the WHO on ethical research prioritization that's specifically pointing at funders. So, at that start of the research funding cycle, there is the opportunity to improve solidarity by being inclusive about who sets the priorities. Then the next step of that cycle is the setup of a funding call. And again, there's a lot that funders can do there. Some funders are restricted in the geographical remit, and that comes, implicit within their setup and their laws. But for those that are not restricted, thinking clearly about that and the setup of the call, and where there are going to be partnerships between countries, looking at guidance prospectively in the call about how to make those partnerships more equitable. And that's where, again, there has been a lot of work done in the funding sphere around what equitable partnerships look like and how funders can improve those. And again, there I point to a piece of guidance that was put together by the Essence group of research funders in collaboration with the UKRI, UK CDR, that covers aspects of that. And again, what funders might be able to do to support prospective thinking about equity and partnerships that could, with it bring the benefits of solidarity. The third stage of the research cycle is the funding panel. And again, there's things that funders can and do in terms of how decisions made and who is making decisions. It inherently, but through the peer review pool and through who sits on that funding panel, value judgments are made, choices are made by the individuals chosen, and therefore thinking really carefully about the makeup of those decision makers is another way to improve practice and potentially improve solidarity in that. We then get to the sort of end of the funding cycle, which is disbursement of funds. And this is also where there is a lot of potential for improvement. That I remember well at Wellcome, the disparities in how rapidly funds could be dispersed to different areas in the world, and the area that I'm particularly interested in, which is epidemics and pandemics, that can cause real issues in terms of who's chosen as a partner if timeliness is important. So again, that's a real area of necessary focus in this, is how one can, especially in fast-moving situations, create environments in preparedness that don't result in inequities in terms of where funding can flow rapidly in those emergency situations. And again, there's some programs that have been put in place around that, like the Good Financial Grants Practice program. And I'll just close with talking also about a few multi-funder initiatives. I think this is sort of in the funding space where there's also some good examples of solidarity coming through. When I was at Wellcome, I was reasonably involved with an initiative called the India Alliance, which was a joint funding partnership between Wellcome and the Department for Biotechnology in India, with funding being put in by both partners, shared design and shared decision making, and the kind of the power dynamics and the benefits that were seen by both partners in that scheme were notable. Other notable schemes being the EDCTP funder scheme, which brings together both European funders with African members, also all putting funding in and with a shared governance around that funding. So I'll sort of end there, Caesar, but hopefully that's some useful concepts to add in addition to Professor Ntusi's.
Yeah, absolutely. This has been great. I mean, on the one hand, listening to Professor Ntusi's reflections about ownership, which helps also with the priority setting, and then Alice talking to us about the whole chain, the funding chain, and where you can actually intervene with more solidaristic or solidarity-like principles. I think this has been quite useful. I see that there were some hands, there were some questions, hands up for questions. So yes, Doji, you seem to be focusing a lot on funding, you asked earlier, so this is your chance now. Yes, can you ask your question? Are you unmuted? Yes.
Yes, hello.
Yeah, yeah.
Thank you for the presentation. I initially asked the question on funding, and just make it simpler. With the global health research funding shrinking, reducing, how important is solidarity in this context? Basically, that's my first concern. And the second concern, maybe for the other panelist speakers, if they are there, I also wanted to, in what ways might we assess the presence or the impact of solidarity? Is there a way, do we have any indicators of solidarity? I just want to know. For the second speaker.
Okay, so those are two questions. Since we're
To
getting
answer the first,
yes,
and invite Alice to speak to the second on measures of solidarity, and she can apply them to each other. So, I mean, how important is solidarity in the face of the receding funding? And the simple answer is that at this time, solidarity in the world and in the global community is perhaps more important than it ever has been. And there are a number of reasons to think why solidarity is perhaps more important now. And I think the point that Alice made earlier about how we position science and health science specifically as a global good that benefits all populations, regardless of the level of support and where it comes from, is critically important. But also the solidarity around the prioritization of the important questions that we ask with science, the solidarity around how new knowledge is generated or how existing knowledge is applied, and the solidarity around how we curate and translate that new knowledge so that its impacts are realized. And when I look at the examples of how science has been impactful, there is a necessary collaboration between multiple sectors in different parts of the world to enable that translation into impact. And that for me is what scientific solidarity looks like. And I think it's critically important at this time. And I think as I've tried to make the point in my earlier comments that funders can play a really important role in influencing those moral and ethical commitments to this kind of solidarity rather than kind of speak I hear whenever I speak with colleagues, particularly from funding agencies in the global north who want to understand constantly practices for their own populations, which is a very big field. So I'll stop there and Alice, over to you.
Thank you very much. Alice, you have the final word in the last few minutes.
Excellent. So indicators for solidarity. I am aware of indicators for equity. I am not aware of indicators for solidarity, and I think it's a fantastic question that I'm hoping Caesar will answer.
So she's handed the question back to me. Maybe we'll talk about that at the next open forum. We're almost at the hour. I know there are one or two more questions, but we will not be able to take them. If you can share them in the chat or via email, we will be able to answer them. But I just want to thank our panelists today. Seye, who I guess has dropped off because it's now past midnight in Australia. Judd, Georgia, Alice, and Professor Ntusi, Ntobeko. Really, this has been very useful. Many important insights have come out of this open forum. And above all, I think there is a general sensation that solidarity, a general feeling and an idea that solidarity is about, actually doing things with our collective agency to be able to help each other. And as we move on from here, we would like to keep the conversation going. And all our attendees, we will be in touch with you to keep you posted and even to continue to think together so that this does not just only become a talk shop, but ways in which we can actually move together in our different settings to promote greater solidarity in the global health space. Because at the end of the day, let us remember that global health is not something that is sitting somewhere in a globe. It is what each and everyone is doing in our own context together that becomes global health. And so in that space, if we can act and enact gestures of solidarity, then we will be contributing to increasing solidarity in global health. Thank you all for joining. Thanks to our team for organizing this. I know it's been a lot of work. And thank you all attendees, especially attendees for joining us and those who have, persevered and stayed even up until 1 minute above the time. Bye and have a good rest of the day, everyone. Thank you.